My name is Nicole and I am a clinical pharmacist at the Miriam Hospital and a medication therapy management or MTM pharmacist here at the Cardiac Pulmonary Rehab. Today we're going to touch base on vaccines and how they serve our health and wellness, especially for those who have lung disease. Your lungs work differently than other people, where you may be at higher risk for negative outcomes if you were to become sick. So we want to promote the best immune system possible. Vaccines are substances made from organisms, dead or alive, or they're made from special proteins such as mRNA. They're administered via injection into your arm usually, and they provide immunity to a disease. Many of the world's most deadly diseases have been almost completely eradicated due to the vaccines that you and I have already received. To maintain this, it's imperative that we view vaccines not only as important for ourselves, but for the community around us. So vaccines, what do? They prevent disease, they protect those with little or no immunity, and they curb the spread of disease. So there's different types, as I mentioned. There's live vaccines, inactivated vaccines, and mRNA. Live vaccines, usually what that means is you have a live virus inside that is activated by your body. You have inactive or dead vaccines where the virus inside is not alive and it will not increase your risk of getting sick. mRNA vaccines are the newer type of vaccine that's used to protect against infectious diseases such as COVID-19. Even though these vaccines seem new, the science and data behind them has been established for quite some time. What mRNA vaccines do is they teach our cells how to make proteins which act as little decoys in the body that pretty much act like the virus, such as COVID-19, and the body is tricked into making immunity and antibodies against it. So we're going to touch base on the different types of vaccines that are beneficial for people with lung disease. The first is pneumococcal vaccines. Those are used to prevent pneumonia that's caused by bacteria only. People with lung disease are already at higher risk and are more susceptible to getting respiratory tract infections, including pneumonia, the flu, COVID-19, and vaccination reduces that risk of getting sick, but also if you were to become sick, the symptoms and the experience will be less severe and hopefully you'll have no complications. The most common bacteria is the Streptococcus pneumoniae, which pretty much is just the pneumonia bacteria. There are a bunch of different strains, and because of the different strains, they have two different vaccines. You have the Prevnar 13 and the Pneumovax 23, which I'm sure you heard of. The numbers are pretty much the only difference. One protects against 13 strains of the pneumonia bacteria, the other does 23. So there's a specific schedule that your doctor is going to follow to make sure that you have your full pneumonia coverage. So for people who are immunocompromised, and that includes people who have chronic lung disease and people who are actively smoking, they're people who need to be considered for both at different times in your life. So what it's recommended is that the Prevnar 13 and the Pneumovax 23 are used at different times and based off of what your doctor thinks is best appropriate for your disease state. So regardless of how we are feeling throughout life, it's important to protect against pneumonia if you have lung disease. Once in a lifetime, usually by the age of 65, you're going to receive the Pneumovax 23. Some people do have this administered a couple times during their life, if, for example, they were young when they first had their lung disease start. So it's important to make sure once we hit 65 years old that we have that Prevnar 13. The Prevnar 13 is usually that once in a lifetime initial booster of the pneumonia coverage. So how it works is at 65 years old, you get the Prevnar 13 based off of what your doctor thinks. By age 65, then you also need to receive your Pneumovax 23. The Pneumovax 23 usually is recommended to have it 1 year after you get your Prevnar 13, just to make sure that your body gets full coverage and there's no complications with how you're feeling with your immune system. If you have any concerns or questions about your pneumonia vax schedule, don't hesitate to reach out to your doctor. The next vaccine we're going to touch base on is for shingles or herpes zoster. Shingles is considered the adult chickenpox. Anyone who's had chickenpox may develop shingles in their lifetime, because what happens is chickenpox is a virus that can enter your nervous system and it stays there and can lie dormant, doing nothing to harm you for years. Eventually, it may reactivate, and when it reactivates, the virus will travel along your nerve pathways to your skin and cause the shingles, which are those super painful patches that usually form around the trunk of the body. Know though that if you had chickenpox, that doesn't mean you will definitely get shingles. But if you have never had chickenpox, you don't have the virus inside you, so your risk of ever having shingles is pretty much none. 1 in every 3 adults gets shingles in their lifetime, and that's pretty prevalent. But the thing that is scary about shingles is that it can actually cause irreversible damage to your nerves, so that's why the vaccine is very important to have. That irreversible nerve damage is actually called post-herpetic neuralgia, and it's permanent. So it's something that we want to avoid completely. Shingles is contagious, but more so for babies and young children. So it's important, if you have children in your life, to consider make sure that you have that coverage so you don't spread it to them. There are 2 vaccines available, or there used to be, I should say. Recently, back in November of 2020, they actually took one of them off the market. There was the Zostavax, which was a live vaccine, and the Shingrix. Now that Zostavax is no longer available on the market simply because the other option, Shingrix, is a better option. It protects you at 97%, where the other one protects you at 70%. If you received the Zostavax in the past, it is recommended that you be sure to get the Shingrix to make sure you have better coverage moving forward. Depending on what your doctor recommends and your health conditions, you may need to get additional doses of the Shingrix. So definitely make sure if you have not received that you had Zostavax prior, that you pursue getting your Shingrix. And if you ever wonder if you need additional coverage, ask the doctor and they'll talk you through that. The next vaccine we are going to talk about is the flu vaccine, which is one of the most important yearly vaccines that all of us should get in the community, especially those with lung disease. It's used to prevent influenza and decrease the seriousness of your symptoms or complications if you do get the flu. It's very contagious, and it's dangerous for those who have lung disease. So during flu season, we want to make sure we get our flu shot. We want to make sure that we are consistently washing our hands. With COVID-19, the masking really decreased that prevalence of the flu, so we know that there's ways to prevent it. The vaccine is super important because it actually, after 2 weeks of getting your shot, will provide you full protection based off of the flu shot for that year. The reason why we have to get it every year is because viruses are very smart. They know how to adapt and mutate so that they can remain alive in the community. So every year scientists have to pretty much reinvent their version of the flu vaccine to make sure that the community has coverage for that year, for that strain of the virus. Everybody should get their flu shot if they're 6 months old or older. And there's a myth out there that says the flu shot is going to give me the flu, or I felt so sick after my flu shot. And that is a myth. The flu shot typically is an inactive vaccine, which means it doesn't have a live virus inside. And that, if you do experience flu-like symptoms, that is actually your immune system responding to the vaccine and providing your immunity. So if you feel a little sick after a vaccine, that means it's working, which is pretty exciting. We're going to change gears into an older vaccine series called the tetanus vaccine series. So most of us are likely covered because these series are typically completed earlier on in life, but it's definitely good to touch base with your doctor to ensure that you're not due for any booster shots or you didn't miss anything. So the tetanus vaccine covers 3 different types of infections. They're no longer common because of all of us getting vaccinated, but they're pretty serious. All 3 of the diseases that we're trying to cover, tetanus, pertussis, and diphtheria, they're all caused by a neurotoxin. And the vaccine is pretty much preventing that neurotoxin to ever be introduced into your body. So the first thing it's protecting against is tetanus. Tetanus, we always think about, we're going to step on a rusty nail and maybe have tetanus flowing in our body. That's why we have our vaccines. If you do step on a nail or have concerns about a bite or something like that, they initiate your booster shot. A lot of people think of tetanus as lockjaw. The reason why I said, it's a neurotoxin. That means it's going to affect your nerves, your brain, and what it does is it controls your neuromuscular system. It causes an infection there where people have muscle spasms and their muscles just start to deteriorate. Pertussis is the next thing that this vaccine is covering, which is also known as whooping cough. Whooping cough is really scary, especially for children. And if you ever look up what it sounds like, it's really scary. It's extremely contagious. It's a respiratory infection caused by the neurotoxin. Symptoms are similar to the common cold, but it's followed by that whooping cough, which is, especially for people with lung disease or for young children, very dangerous because the way the cough works is it really completely blocks that ability to get a good inhale of oxygen. The last disease state that it is covering you for is diphtheria. I'm sure diphtheria sounds like one of those old conditions that we're scared of, and that's why this vaccine series is so important. This is also a respiratory tract infection that's caused by a neurotoxin. It also presents similar to the common cold. So that's why, even though these diseases are not common anymore, they're scary because they present as a common cold and can, transition to something really serious. And the vaccination process is imperative to make sure that we don't spread this to children or people who have immunocompromised conditions. So usually this is a 3-dose series. You have 3 different versions, one vaccine, the second vaccine, the third vaccine. They all have different levels of different protection for that tetanus, pertussis, diphtheria. Every 10 years we recommend to get a Tdap or TD, which is that booster shot I keep mentioning. And that just pretty much, as you go on through life, make sure that you have that extra immunity boosted in your system. If you didn't think that you received all 3 doses of the original series, just get it again. It's not going to hurt. So if you're something in the back of your mind saying, I don't think I ever got that, or I have no idea if that's documented anywhere in my history, we would just repeat it to make sure that you're not at risk for those at all. I know I keep saying this, but it's really important to get that booster for the sake of the young children in your life. So, for example, expecting mothers usually receive a booster shot regardless if it's that 10-year period. This is for each pregnancy, and if you have someone in your life who is expecting, it's recommended that any close family or friends that will be in contact with the baby or the child get the booster shot as well, the TD or Tdap. So something to keep in mind if any of you have grandchildren on the way. So as an MTM pharmacist, know that I'm a resource to you at any time. I can be an advocate for you at any time during or after your program here. So if you would like, we can sit down and chat about absolutely anything you may need. It can be medication related or not. I'm in your corner, know that, and please reach out to your case manager to schedule an appointment. Thank you so much for your time, and if you have any questions, you'll find me walking around the track.